exercise. It's an exercise for stabilizing the pelvis and the lower back. Don't do this exercise when you're in pain. It's more of a rehabilitative exercise to do to build your back better. Start off on all fours. Spread your legs 90 degrees so you're like a table. Head in line. Tummy pulled up and in using your transverse abdominis muscles. Shouldn't be so far in that you're using your chest and you can't breathe, but in about 50%. So there's still room to pull it in more. There's still room to let it out. When you do it, it's supporting your back. Your back's not going up and down like this. Just tummy up and in. You start actually with your neck, this scooping motion, as if you're trying to get your chin a chain. Neck should come back as if you were standing up straight. Should make you feel a little bit choky in your throat. Yep. Head's not like this. Scooping action down to get your necklace and back up here. Tummy's up and in as if you've got a pint glass resting on your pelvis. The whole idea is to keep this pelvis nice and steady, nice and smooth movement. You're going to be lifting opposite arm and opposite leg. It's not a stretch, it's not how far you can go, it's on how smooth and steady and how level you can keep this pelvis. Nice and easy, just like this. Down, set your neck. Keeping your tummy in, nice and stable. Back. Watch when you do this exercise. If you watch right here, you may not realize, but you'll be twisting your pelvis. It's handy to have someone set it for you properly. You try to remember that position, concentrate on the position, go down, and then go straight back to it until you've got it right. If they need to correct you, they correct you again, and you go straight back to it until you've done it correctly a couple of times. The other thing that people do wrong, they don't bring their pelvis up. So you'll need that corrected. Someone will tell you, and then you remember it, go back down, and try to go straight back to it corrected. You're trying to repattern your spine and its movements, and the idea is that you do the exercise correctly. The more correct you do it, the better. You do this exercise about 10 times each side. Watch when you do it, that you don't forget about your tummy and your tummy sags. It's all about on how stable you can do it. Not on how many times. It's not a stretch to see how far you can stretch. It's just a movement pattern, which is mimicking the walking pattern and trying to get some stability through there. Shouldn't be painful. Some people feel better after they do it. That's fine, but it's not supposed to make you feel better right away. It's one of those exercises to make you feel better after a few weeks of doing it. It's a cross-crawl exercise.